Greetings, acugynecology patients, endo warriors, and acupuncture friends. It's Dr. Stephanie again, sharing some pearls of wisdom. If you are someone who already follows some of my social media platforms, you might have already seen posts where I talk about COVID stress syndrome, or as I like to shorten it to, CSS, and sharing some of the tips that I think help with COVID stress syndrome. To me, COVID stress syndrome is the added pressure that comes from COVID and all it entails. You might be experiencing stress and anxiety due to people not wearing masks. You might be homeschooling your kids, which adds an element of stress. You may be working from home, which adds stress. You may be working out of the home, which adds stress. You might not be able to work right now, which adds a whole other element of stress. You might live in a state where positive cases are still on the rise, increasing the amount of stress that you have. CSS can manifest as anxiety, frustration, anger, insomnia, just to name a few of the things that go along with it. Several of my patients have felt that their once a month, weekly, or quarterly even tune-ups are not enough right now to manage some of this stress. So this brought me back to the idea of mini sessions and the idea of having patients come in between their regular visits for mini sessions. So if you are already a patient, you know that you come in and we do an intake. I put the needles in, you're on the table for about 30 minutes. And before I put the needles in, there's this Q&A that we kind of go back and forth with questions and answers. So in a mini session, there is not that same back and forth Q&A. There are predestined points that I use that are part of the one protocol is an auricular protocol, which is acupuncture points that are in the ears. And I use the NADA, N-A-D-A protocol that is used for detox. It just happens to be one of those things that really hits stress and kicks it out kind of quickly and sort of resets the parasympathetic nervous system and allows you to relax more. So during these mini sessions, the time is shortened. So you're not going to be in for 45 minutes to an hour. You'll be in for a quick 30-minute visit. And like I said, one of those treatments is this auricular treatment. So you can choose the auricular treatment, or you can choose what I like to call a moment of Zen. And the moment of Zen is 3 points in the ear, 3 points in the wrist, and 3 points on the ankle, 2 points on the scalp. So it takes about 5 minutes to put the needles in, and then you're relaxing on the table for about 25 minutes. And then you can go about your day or evening. Some people are choosing to add one a week. Some people are doing this twice a week just to kind of get through the stress that's going on in their lives right now. So these quick little treatments are good at reducing stress and tension, and they're a great way to supplement your regular treatments or in place of regular treatments because you might be short on time because the kids are at home or you're working from home or whatever is getting in the way right now. If you are an existing patient, you can just schedule one of these mini sessions by visiting the website and selecting auricular treatment or moment of Zen. If you are new to our center, we do ask that you still schedule a full first intake and evaluation as your first visit so that we can make sure that you don't have anything that should be addressed with greater attention, something that you may need a longer visit for. So for more information on everything that we do, check out our website. All the details will be below. Like and follow us on Instagram. Make sure you like our Facebook page. Also, make sure you check out the new podcast that I started called the Practical Medicine Podcast. You can follow that on Facebook and Instagram as well. It is done every other Monday, and we pick different topics, and it's a colleague of mine and we talk about ways to stay healthier. So until your next visit on the treatment table, stay healthy and well, and I will see you soon.